Hi everyone, and welcome back to the third installment of the Menopause Diet and Cancer series. Today we're going to be looking at genitourinary syndrome of the menopause and gut health. My name is Kitty Johnston and I'm a CORE registered dietitian. I have Dr. Samantha Cushion, a CORE registered dietitian, with us today.
Thanks, Katie. So Katie's going to be taking you through all aspects of diet in relation to the genitourinary syndrome of menopause for cancer survivors. And then I'll be taking you through the supplements. What supplements that have any sort of research behind them, what supplements to avoid, include in the diet that could possibly be linked to gut health and genitourinary syndrome.
So today we're going to be looking at what genitourinary syndrome of the menopause is, why is it happening, how to eat well to manage these symptoms, why gut health is important, and eating well to support gut health, as well as looking again at supplements. And just a reminder that these webinars are not specific, therefore general information. So if you are experiencing any symptoms, please consult your medical oncologist, your radiation oncologist, your clinical nurse specialist, or a registered dietitian. So what is genitourinary syndrome of the menopause? Well, following treatment for cancer, particularly breast or gynecological cancers and colorectal cancer, you may experience some symptoms that affect your bladder, your vagina, or your vulva. And whilst this is a sensitive topic, many women who go through treatment experience these. Up to 50 to 75% of people with breast cancer will experience one or more symptom related to the genital or urinary areas. The symptoms of this syndrome include the increasing need to urinate, urinary incontinence, so maybe not making it to the bathroom in time, vaginal dryness and itching, a decreased libido and pain during sex, as well as urinary tract infections. So why do these symptoms happen? Well, genitourinary symptoms are part of an array of menopausal symptoms that are caused due to perhaps cancer treatment that has induced menopause early and or menopause that has reduced the amount of estrogen in your body. The effects of estrogen suppression are more severe in the vagina, urethra, bladder, and pelvic floor muscle tissue due to the large role that estrogen plays in these body parts. And actually reduced levels of estrogen in the body due to a surgically induced menopause or an endocrine therapy can cause the muscles around the pelvic floor area and the elasticity of the urethra and pelvic floor to weaken. And you can see here on this diagram, we can see the vagina before the menopause, and you can see that it's well estrogenized and lubricated, and afterwards it becomes sort of thinner and drier. So the decline of estrogen in the body because of menopause leads to declined collagen, elastin, and hyaluronic acid content in the urogenital tissues. And these compounds help your muscles and tissues to stretch and recoil to their normal shape. And when the amount of those decline because of declining estrogen, your tissues weaken. Again, this can lead to incontinence issues such as leaking urine when you cough, sneeze, laugh, and vulvovaginal atrophy symptoms, and that includes vaginal dryness, burning, irritation, itching, and bleeding. You might also experience some changes to your bowel habits after treatment and during menopause, and this can be a direct result of cancer treatment or as a symptom to changing hormone levels such as estrogen. If you have received radiation due to gynecologic cancers or a colorectal cancer, you may experience something called pelvic radiation disease. Just to touch briefly on pelvic radiation disease, this webinar is not designed for those who have pelvic radiation disease. You will need specialised specific management for that, and please contact your medical team, your radiation team, or a registered dietitian who will be able to help you with this. People who have had radiotherapy or brachytherapy, so that's internal radiotherapy, to their pelvic region during their cancer treatment may experience symptoms in their gut, and this is because the damage to the that the radiation causes to the gut can affect its normal function. Symptoms can start and continue 3 months or more after the end of your radiotherapy. So it is something to be mindful of. If it's not normal, please do contact your medical team. These symptoms again include pain during sex, fatigue, bladder difficulties, so leakage and lack of control, and bowel and stomach difficulties. So you might experience some bloating, wind, diarrhea, gurgling, constipation, needing to go very urgently. And again, please always consult your medical or your radiation oncology team. So you might also experience some menopause-related bowel changes, and again, this is as a result of declining estrogen during menopause, and this can include constipation or diarrhea. And again, this is because of the role that estrogen plays in our gut. Furthermore, we might experience some increasing levels of cortisol, that's the stress hormone, and that also may have an impact on our gut and our bowel health because of something called the gut-brain axis. This may contribute to or aggravate gastrointestinal symptoms and cause changes to bowel movements. The gut-brain axis describes the physical and chemical connections between our gut and our brain. And the connection works both ways, which means that a troubled intestine or a troubled gut can send signals to the brain, and a troubled brain can send signals to the gut. Please always contact your medical team if you are experiencing changes that maybe don't resolve within a few days. So, can what I eat and drink help with genitourinary syndrome of the menopause and gut health? Absolutely, yes, you can. Certainly, dietary patterns, foods, nutrients have been found to reduce symptoms of GSM, while others may trigger them. By choosing the right foods and drinks, you can potentially improve your comfort, manage these symptoms more effectively, and improve your overall gut health. Whilst we may be focusing on specific symptoms, specific foods, looking at our overall dietary pattern is the most important thing that you can do. There are many nutrients that we will discuss over the course of this webinar. But again, looking at the Mediterranean diet, getting in 2 to 3 servings of poultry and fish per week, that includes our omega-3 fatty acids, omega-6 fatty acids, our essential fatty acids, our whole grain carbohydrates, our pulses and our legumes for our fiber, our dairy products for calcium, and our healthy fats, and our fruit and vegetables, as well as olive oil for our polyunsaturated fats. So again, looking at our overall diet and not focusing just on one specific food. So firstly, I'm going to talk to you about prebiotics, probiotics, and symbiotics, which have become very, very popular in the last number of years. They may help to manage symptoms such as vaginal dryness, itching, and recurring urinary tract infections, as well as supporting our gut health and our microbiome. These nutrients have become more popular in recent years, and there's plenty of supplements on the market, but actually we can get a really good source of these from common foods in our diet, and from a lot more common foods than you might think. So we'll firstly touch on probiotics, and probiotics have been used to help improve our gut health by balancing the gut bacteria. Probiotics are live bacteria that can help you digest fiber and keep our gut lining healthy. They are found in many different forms, such as foods like yogurts, sauerkraut, which is a fermented cabbage dish, kombucha, kimchi, which again is another fermented cabbage dish, pickles, kefir, and miso. So we get them in a wide range of food sources. And you may also find them in tablet forms or in sachets on the market. However, now some probiotics may not reach the gut because they are killed by acid in the stomach. And one way of increasing the natural good gut bacteria is through prebiotics. So prebiotics almost act as like a fertilizer for our gut microbiome, which helps more good bacteria grow in our gut. And they're generally found in types of fiber. Prebiotics are often found in many plant foods that are probably already included in our diet, such as onions, garlic, asparagus, mushrooms, cabbage, things like that. So it's very, very easy to include these in our diet without changing it too much. And then we have something called symbiotics, and these are a combination of prebiotics and probiotics that work together to affect the development of beneficial gut bacteria and to prevent the development of bad bacterial flora or gut bacteria in the intestines. And again, these can be found as either a supplement, but actually we would promote the food first approach. So you can find them in things like yogurts, kefir, whole grains, and sauerkraut, again, that fermented cabbage dish. So how can probiotics, prebiotics, and symbiotics help with genitourinary syndrome of the menopause? Well, there is some small evidence that probiotics may also be beneficial to treat or prevent gynecological conditions such as bacterial vaginosis or thrush due to their effect on the microflora or our gut microbiome in the gut and our vaginal microbiome as well. There is also evidence that symbiotics have other benefits, including lowering our cholesterol and improving the absorption of magnesium and calcium in the body. So the current recommendation is to try and include up to 30 different plant foods in our diet every week. This might seem this might seem difficult to start with and a bit overwhelming, but actually we probably are including a lot more than we think. So our top tip is just to try and increase it every week if you can. Maybe try and add 1 or 2 more plant foods in your diet per week. And again, looking at the overall benefit that these nutrients can have, not only for our gut, but also for lowering cholesterol and increasing the absorption of magnesium and calcium in the body, which is really, really important during this time as well. So how do you increase plant foods in your diet? Well, it's very, very simple. At breakfast time, try and add fruit to your morning cereal or porridge. In snacks, try and include fruit and vegetables in your snacks. Maybe have some fruit on top of your yogurt. Maybe have a hummus dip made of chickpeas and some vegetable sticks. Lunchtime, try and have whole grain bread, add in some tomatoes, cucumbers, peppers, or lettuce leaves, or maybe have a side salad at lunchtime. And at dinner, this one's great for kids as well. If you're making a pasta sauce, try and blend in some additional vegetables too. For your shopping considerations, it's absolutely perfect to use frozen fruit and frozen vegetables. If you find that buying fresh is going to waste, they are just as nutritious as the fresh stuff and can help maybe save money and prevent food waste in the future. And again, just some more tips. If you're making a spaghetti bolognese, maybe try and reduce the amount of meat by half and replace with a can of lentils to increase those plant-based foods, the pulses and the fiber. Snack on nuts and seeds. Try making granola bars or power balls. Try some vegetarian versions of some common dishes, including a lot of pulses and things like chickpeas and lentils. And try and again add extra beans into something like a chili con carne. So I'm going to briefly talk about genitourinary syndrome of the menopause and betaine. And there's been some small research that has said that betaine may cause symptoms such as vaginal dryness, itching, and recurrent tract infections. And it's a micronutrient that's found in wheat bran, wheat germ, spinach, shellfish, and goji berries. And again, there is some research that suggests it has a positive effect on the vaginal microbiome through its action in the gut. So trying to include some sources of betaine in our diet throughout the week may help to contribute to a healthy vaginal gut microbiome. And again, including things like wheat bran, wheat germ will increase our fiber, spinach to increase our macronutrients, and goji berries as well, increasing the seeds that we have in our diet. So next, we're going to discuss genitourinary symptoms of menopause and diets low in simple carbohydrates. There has been some research that suggests a diet low in simple carbohydrates may make genitourinary syndrome of the menopause symptoms worse, such as vaginal dryness, itching, and urinary tract infections. And they're suggesting that the large volume of simple carbohydrates, such as white bread, processed cakes, buns, promotes the development of abnormal or bad bacteria in the vagina or the vaginal microbiome. This abnormal flora may create an environment where yeast-like infections thrive, and that may lead to vaginal infections. So switching to whole grain carbohydrates will have a positive effect not only on our gut health, but also on our vaginal microbiome. So practical tips for increasing whole grains in our diet, very, very simple. Just swap from a refined cereal to something like a porridge or a whole grain cereal. At lunchtime, swap white breads for your sandwich to a whole grain or a wholemeal bread. Swap your snacks. Maybe if you're having cheese and crackers as a snack, try and include the whole grain cracker. And again, leave the skins on your potatoes if you're making them for dinner, or swap from white rice to a brown rice as well. And just to remember that if we are eating more whole grains, it's important that we stay hydrated and increase our fluid intake. And this is because of a nutrient called fiber. And dietary fiber is the part of the plants you eat, but it's not digested in your small intestine. Instead, it is completely or partially broken down through fermentation by bacteria in your large intestine. And fiber is essential for our gut to work normally. It increases the good bacteria, which supports immunity against inflammatory disorders and allergies, as well as an array of other benefits. So fiber helps to control our blood sugar levels. It helps to lower our cholesterol. It helps to improve our bowel movements and again, improve good bacteria in the gut. It helps reduce inflammation in the gut, and it also helps to maintain our bowel health. It is also linked to lower odds of depression. So for every 5 grams of fiber that you include in your diet, your risk of depression goes down by 5%. So How does fiber work? Well, there's three characteristics of fiber. It's soluble, so it has the ability to absorb and dissolve in water. It's viscose, so it has the ability to form a gel-like substance. And it's also fermentable, so it has the ability to be broken down by colonic bacteria that produce gas in our diet. So there are different types of fiber, and each type of fiber plays a different role. So we have something called soluble fiber, and that dissolves in water to form a gel-like material and slows down the digestion of food. And as a result, it benefits, it can help to lower your blood cholesterol and your glucose levels. And we can find it in things like oats, peas, beans, apples, some citrus fruits, carrots, and barley as well. And then we have insoluble fiber. So this adds bulk to our stool, and it appears to help pass food more quickly through the stomach and the intestine. And it can be beneficial to those who struggle with constipation or irregular stools. Again, if you have pelvic radiation disease, it's really important to discuss this with a specialist registered dietitian or your medical team. And the sources of this include whole wheat fiber, wheat bran, nuts, beans, and vegetables such as cauliflower, green beans, and potatoes. So how much fiber do we need per day? Well, the recommendation is 30 grams per day of fiber. So this might seem like a lot, but actually when we break it down, it can be very manageable. So 30 grams of fiber in a day looks like a bowl of porridge in the morning with some chia seeds and a banana, and some whole grain or wholemeal bread at lunchtime with an apple. And if you're having a yogurt as a snack, getting your prebiotics in there, you're also popping some berries on top of it. And at dinner time, you're maybe having 2 medium potatoes, leaving the skin on, and 1 medium carrot with the skin on as well. So it's very, very easy to reach that 30 grams of fiber per day. As I said, if we're increasing our fiber, we also need to increase our hydration. And this can also help again with our GSM symptoms. So a lot of the time we see people that are, always running to the toilet, and when they get there, they don't actually have to go. So what we choose to drink may have an impact on how often we urinate and if we irritate our bladder. What we choose not to drink as a way to stop ourselves going to the toilet so often may have an impact on how often we open our bowels, and it can increase our risk of constipation. So it can be this cycle of you feel like you have to go to the bathroom all the time. You reduce the amount that you drink, and then on the other end, you end up constipated. So there are certain drinks that can irritate your bladder. We should aim to have at least 8 to 10 drinks a day. So that's around 1.5 to 2 litres. You also might require more fluids if you're sweating due to hot weather or exercising. And while 8 to 10 drinks may seem overwhelming, breaking it down over the course of the day can help you achieve these recommendations. We talked a little bit earlier on about drinks that can irritate our bladder and drinks that don't irritate the bladder. So on the left-hand side here in the sort of the darker blue color, we can see the caffeinated drinks, things like tea and coffee can irritate our bladder. Green tea, alcoholic drinks, carbonated energy drinks, and fizzy drinks, especially things like cola and acidic fresh juices, can irritate the bladder. So if you are trying to keep hydrated, maybe try a decaffeinated tea or a coffee, water, all types of diluted juice, but maybe opting for a sugar-free or a no added sugar version, non-acidic fresh juices, and red bush tea, and most other herbal teas, so things like a mint or a lemon tea as well. So just an example here of how we reach our recommendation. So hydration for a healthy bladder. So maybe at 7 o'clock when you wake up, you're going to have a glass of water and some coffee. And then at 9 o'clock, you're going to have a glass of water and maybe bring a reusable bottle with you. We're going to have a mint tea maybe instead of another coffee. Then we're maybe going to have a glass of water with lunch. Then maybe in the afternoon, and this is a weekend as well, for example, for maybe in the afternoon, if you're watching a movie or something like that, you're going to have another glass of water, and then you're going to have your reusable water bottle on hand. You're maybe going to have a mocktail instead of a cocktail at dinner time, and then you're maybe going to have that glass of water between dinner and dessert, and then another glass of water before bed. So it's very easy if we break our day down to reach those hydration recommendations. So Samantha is going to take us through now some supplements for vaginal health and what to look out for.
Thanks, Katie. So I think you've given a lovely overview there of probiotics and prebiotics. And I suppose the first thing to know about supplements for vaginal health is that there are no proven supplements on the market that are going to help with, I suppose, irritation, dryness. The only thing that we would suggest that there is any sort of benefit would be the likes of probiotics. And probiotics, as Katie has clearly explained, can be found in foods such as kefir, sauerkraut, kimchi, and they're cost-effective ways of supporting gut health without the need for expensive supplements. And it's important to know that you don't actually need to spend a lot of money here on probiotic supplements. There's more affordable options available, and the effectiveness of the probiotic, it depends on the specific strain, not on the cost or the actual the price of the supplement. So it's all about the strain of probiotic within the supplement that's going to have the beneficial effect on vaginal health. So if you are going to look at a supplement here, a probiotic supplement, choose one that has a strain called lactobacillus in it. And actually you'll find lactobacillus present in yogurts. So yogurts actually contain lactobacillus strains, which are good for vaginal health. Lactobacillus, it's a natural good bacteria. It colonizes the vagina of a healthy individual. It maintains vaginal pH, and it can actually help them prevent infections by bad bacteria. If you're choosing a probiotic supplement with this particular strain, follow the instructions on the packaging around the dosage and around how you should consume it and for how long. We would always advocate that you go for a single preparation. What I mean by that is go for a probiotic that has no added vitamins or minerals, particularly herbs, because a lot of the supplements targeting menopausal symptoms will always more than likely have added herbs or vitamins and minerals in them that you possibly do not need. The other thing I'd say here around probiotics is that anyone who has a compromised immune system, they might be at risk here, and they should actually consult their doctor or their consultant around taking probiotics or prebiotics even, especially during active treatment, during chemotherapy. A lot of consultants oncologists will actually say to stay away from probiotics. So please do consult your team if you are going through active treatment and considering a probiotic. When it comes to supplements for vaginal health, so as I've said, there's actually very few, if any, supplements on the market that have any proven benefit. So that's a good thing to know, because you're not missing out. You're not missing out on anything if you skip these supplements, or if you don't take any specific supplements for vaginal health. Your health and your safety comes first, and the potential risk for interactions with your medications, and specifically tamoxifen, far outweigh the proven or the unproven benefits, I should say, for these supplements. So the ones I would say to avoid if you're on tamoxifen, the supplements that are usually out there targeting or marketed towards vaginal health, irritation, and dryness, sage would be one that's often used for vaginal dryness and irritation. However, there is possible interactions with tamoxifen. I've gone through this a bit more in detail in a previous webinar on hot flushes and night sweats, so please look over that if you want some more details. The same with turmeric. Turmeric is sometimes taken for its anti-inflammatory properties, antioxidant properties, and there's been some links between the anti-inflammatory properties of turmeric and helping improve the inflammation within the vaginal tissues and the mucous membranes. However, in high concentrations, especially in a supplement form, in a concentrated supplement form, there is emerging evidence that it can be linked to interactions with tamoxifen, and it can decrease the effectiveness of tamoxifen in the body, which means that you're not getting the most benefits out of the tamoxifen that you should be if you're taking turmeric at the same time. So we would highly advised to avoid those two particular supplements. As well as those two, one I didn't put on the slide there, Katie, was isoflavones, or I suppose soya supplements. We've previously advised against that in our night sweats and our hot flushes webinar. Some women will take high dose and high strength soy supplements for vaginal health, again because of the phytoestrogens that can possibly help with the irritation in that area. We would avoid against those supplements as well. We would say soy in its natural form, in its food form, perfectly fine, but in a supplement form to avoid. The other thing, I suppose, when we're talking about bowel function and gut health here in this webinar, is that sometimes if you are having if your bowel symptoms can limit the amount of fruit and veg you can eat, or limit the amount of fiber you can consume, Out of all the supplements on the market, a standalone, I suppose, a multivitamin preparation with no herbs, no botanicals, just a multivitamin. So something like a one-day multivitamin like Centrum or Pharmaton, or again, there's lots of different companies that produce them, that can help compensate for reduced intake of vitamins and minerals. It might be something worth discussing with your team, your dietitian, your pharmacist, but try and go for a multivitamin if you're going to take one that has no herbs added into it. So no sage, no turmeric, no isoflavonoids. That would be the key there.
Thanks, Samantha. So that brings us to the end of this gut health and genitourinary syndrome of the menopause webinar. So just some key takeaways for you. And again, as we mentioned at the start of this webinar, the Mediterranean diet is the best diet that we can be eating at the moment. Not only can it help with our gut health and our genitourinary syndrome of the menopause symptoms, it can also help with our bone health, with our heart health, and with our body composition as well. Including more fiber in our diet will help our gut health too, and again, increasing our fluid going hand in hand there too. If you have lost weight or feel that you don't know what to eat, then please ask for a referral to a registered dietitian in oncology. They will be able to help you during this time. We have limited evidence that any supplements will help with menopausal symptoms like vaginal dryness. If you are unsure about supplements, then please ask your doctor, your pharmacist, or your registered dietitian for guidance. Information is power at the end of the day, and we can only help with what you disclose to us. Speaking with a specialist dietitian can also greatly help you to increase the variety and nutrient content of your diet, as well as prevent and manage any symptoms that you might be having. So please do ask for a referral to a dietitian if you feel that that would be beneficial to you. The Irish Cancer Society offer a range of services and supports, and their support line free phone number is on the screen. They also have 13 nationwide daffodil centres that you can pop into in hospitals. They also have counselling, peer support, and night nursing services as well. The final part of this series is a live webinar with a question and answer session on Thursday, the 17th of October at lunchtime. You can scan the QR code on the screen using the camera function on your phone to register, or you can use the link in the description below. And again, please send your questions to researchadmin@irishcancer.ie, and Samantha and I will be answering them on the day. So thank you very much for listening to this third webinar, Genitourinary Syndrome of the Menopause and Gut Health. We hope that you find it helpful and enjoyed it.
Thank you.